Y a la CCNet la conocí justamente buscando información sobre medicina basada en la evidencia. Fue bastante gracioso porque lo primero que vi fue una foto que parecía que era mi abuelo y era Cochrane. Y a raíz de eso conocí la medicina basada en la evidencia. Me impresionó ver cuánta gente colabora alrededor del mundo en este tema y cómo los consumidores particularmente podemos ayudar a conformar estas redes que diseminan información científica seria.
The Cochrane Consumer Network, or CCNet, is an organisation made up of consumers around the globe. So we have approximately 500 consumers from something like 40 different countries.
What I like about Cochrane is that it pulls research from all over the world, large and small studies, and you can come up with the best possible available research on any given topic.
Somebody's there determining, at Cochrane, determining the quality of the studies before they get into the review. And they're answering the most basic question for consumers, which is, does this treatment work?
The tool I use has always been the plain language summaries, which is a component of the Cochrane systematic reviews. What we normally do is to pull down the plain language summaries and use that as a dissemination tool in the local level. There is evidence that insecticide-treated bed nets can be effective in controlling malaria. So what we did to share this evidence with the local community was to talk with the leaders, talk with the insecticide-treated bed net distributors for them to help us get these nets across to community people in Nigeria.
Inviting everybody in means that consumer advocates and patient advocates can take part in every level of what the Cochrane collaboration does. You are a peer reviewer if you want to do that for protocols or finished reviews.
And when I did my review, I was fascinated that it was reviewed by a consumer group. That's the idea was very new to me. Because in our part of the world, Asia, I'm talking about India, Sri Lanka, the consumer groups are not so strong.
You know, as a patient advocate, what the public wants to know, what's the missing information. Often it's something like quality of life information. You know, what will this treatment do to my quality of life?
I really like the fact that Cochrane Consumer Network is evidence-based but also has a human approach. And I think we bring that as a constant reminder to researchers, because often I think they're forgetting that there are people behind the statistics.
Actually, pretty well it taught me that we doctors, medical doctors, just deliver our things without thinking what the patients, consumers, what they want, what the information they want. I learned my first lesson there.
A friend of mine in Australia had early breast cancer and had surgery and was being asked to undertake radiotherapy after surgery. She found a Cochrane review, and thinking about that Cochrane review, decided that she would not have radiotherapy because there was not sufficient evidence to show that it would actually improve her survival. And she's still alive to tell that story, and she is now one of the patient champions for the WHO program.
I am interested in the dementia and the cognitive impairment group, and I'm especially because of my wife suffer from the dementia. I'm interested in dementia, Alzheimer's disease, as well as the mental health issues.
Essa rede é uma rede formada por voluntárias, mulheres, que desejam compartilhar e informar outras mulheres sobre os benefícios do parto ativo. E eu comecei através da minha própria experiência de ter tido um parto natural, que é uma coisa difícil aqui no Brasil atualmente. A gente tem altos índices de cesarianas na rede privada e você tem que lutar para conseguir ter uma coisa mais natural possível, que é dar à luz espontaneamente. Nós conhecemos o trabalho da biblioteca porque usamos o material da biblioteca para evidências científicas nos nossos sites, nos nossos fundamentos, entregamos naquela ação que movemos no Ministério Público.
Y en donde hablamos de que algunas de las prácticas de las parteras tradicionales están apoyadas por evidencia. Hemos logrado que los médicos también reconozcan, en parte, no es que reconocen completamente las acciones de las parteras tradicionales, pero en parte sí. Por ejemplo, la versión externa, ¿no? La versión externa es un ejemplo muy claro de cómo la mayoría de los médicos en México no la sabe, no la practica. Cómo voltear a un bebé para que pueda nacer, ¿no? Y evitar una cesárea. Y la mayoría de las parteras tradicionales lo saben hacer muy bien. Entonces, cuando hablamos de este ejemplo, con las autoridades de salud, pues tiene peso, ¿no?
Toda Latinoamérica es muy distinto. Los consumidores latinoamericanos somos mucho, no estamos acostumbrados a desarrollar las defensas que los consumidores en otras partes del mundo. No tenemos las redes formadas fuertes, no somos institucionalmente fuertes.
From my personal ability, I cannot promote this. I must get the support from the government, also from the Medical Doctor Association from China to promote patient safety, and also we call consumer involvement in medical decision making. If doctors agree or the directors in the department agree, then I can distribute. If they are not agree, I cannot distribute any materials.
Especially in areas like Iran and the Middle East, in which the consumers do not have a voice. And it is important that they are affiliated with the Cochrane collaboration, because they say, okay, it's an international organization with high quality of research, many consumers involved in it, so they have something to say, and it's important to listen to them.
En mi país, en mi estado, en donde yo vivo, yo fui a hablar con las autoridades de salud y les dije que si conocían la Biblioteca de Salud Reproductiva, y me dijeron, estaba empacadita, y me dijeron que sí, pero que no podían abrirla en las máquinas que tenían, eran máquinas viejas. Entonces, bueno, hay también un trabajo tecnológico que llevar a cabo para poder hacer que la evidencia llegue a más partes del mundo, ¿no? Que no tienen los recursos necesarios.
Oh, it's really been great working with the Consumer Network. It's an international group. The interaction is so great that you learn so much from each other.
I'm very proud to be a member of the Cochrane Consumer Network, and I'm very happy that we made such an international network, and I hope that this international network would help me to change the way of the practice in Iran, so that we could influence the clinician to more understand the patients and more involved in decision making.
The colloquium here in Latin America, the first in Latin America, has given me an incredible opportunity to network with colleagues from Central America, South America, colleagues who are doing very important consumer movement work that I wouldn't necessarily get to speak with and get to know and get to forge relationships with.
We can, as being known as an international network of carers and the service users, so we can exchange our experience, personal experience, family experience, care home experience.
We must be strengthening the voice of the consumer globally. And that gives me a real sense of achievement, that this is worthwhile. So let's keep going, let's build on this, and let's strengthen that consumer voice.